Mouth care for residents in continuing care. Welcome to Observing for Changes, the Healthy Mouth. This module presents information on the appearance of healthy and later unhealthy conditions in the mouth, as well as residents' behaviors and characteristics that influence or detract from maintaining good oral health. Observation is key to understanding each client's needs, their ability to provide their own daily mouth care, and the type and amount of assistance they may require, and any changes that may signal a change in their oral health care needs. The resident's mouth can be observed by all care staff, RNs, LPNs, HCAs, speech-language pathologists and dietitians, and family members during any interactions with the residents. Alberta Health Services has developed a mouth care training program to support healthcare providers in continuing care facilities to address the daily oral health care needs of residents, recognizing that good oral health is an integral component of the resident's physical, social, and emotional health and well-being. The framework of the program has 4 parts. The mouth care planning with the RAI MDS oral assessment tool in a mouth care decision trees format. 2, an oral care plan tool based on the RAI outcome scales that identify residents' level of independence. 3, daily mouth care with appropriate support and strategies for managing challenging behaviors. And 4, referral to dental professionals for treatment as required. Each member of the healthcare team, registered nurses, licensed practical nurses, and healthcare aides all play a role in supporting the residents with their oral health. Today you will learn how to assess the appearance of healthy and unhealthy conditions in the mouth. As an HCA, you will see what you need to report to an RN or LPN. As the RN and LPN, you will need this information for the mouth care planning module and for making decisions regarding referrals using the mouth care decision trees format. Check and report changes. Many common oral health concerns experienced by residents have observable triggers. Reporting these triggers means early assessment, care planning, and treatment for the resident. The HCA has a very important role. The HCA has the most direct contact with the resident each day. The HCA can observe changes in the resident's oral health status during daily mouth care, meal times, when speaking to the resident, or when the resident is sleeping. By being the eyes and ears for possible triggers, HCAs can provide the RN or LPN with valuable information that will help them provide timely assessment and interventions. If you notice the resident has a bad breath, bleeding gums during brushing, broken teeth, sores on their lips or gums, any lumps, bumps, or sores, you should report these changes to the RN or LPN. The decision trees are designed to assist in the identification of potential oral health triggers by all long-term care staff. Once an oral health trigger is identified, it is reported to the RN or LPN responsible for that resident. Some of the possible oral health triggers are visual changes of the face and inside the mouth, verbal complaints by the resident, physiological changes in general health, and behavior changes during mouth care and eating. The RN or LPN uses the decision points to determine if there is a need for further assessment and intervention to refer or to manage the oral health issue. Finding oral health problems early will result in less discomfort and pain and a decrease of infections for the resident, less costly treatment, less irritability, and care-responsive behavior. The resident will have improved self-confidence, improved overall health and well-being, and improved social interaction. Here's an example of one of the decision trees that focuses on chewing problems and mouth pain. In the column on the left, it gives a list of observable triggers for chewing problems and 3 categories of observable triggers for mouth pain: physiological changes, verbal complaints, and change in behavior. If any of these are yes, then you would refer to the decision points. Is the origin of the chewing problem or mouth pain related to oral health? If yes, is it related to their natural teeth, to the soft tissues, or to dentures? If it is no, then you may want to investigate other physiological factors in consulting other members of your team. If the problem is associated with their teeth or their dentures, they may need to be referred to a dental professional. The mouth care decision tree document is explained in the module of mouth care planning using the RIE and disablement process. You may want to refer to the mouth care decision trees document. Are you going to be checking inside the person's mouth? Are you going to be doing an oral assessment using a toothbrush and a flashlight? If so, the IPC best practice protocols for continuing care indicate the following practices should be considered. Assess the task, the resident, and the environment prior to each interaction. Routine practices are to be used with all residents for all care. Performing a risk assessment is the first step in routine practices. Consider the notes box in the right-hand corner. Blood and body fluids. Blood and body fluids for mouth care and an oral assessment will include saliva for all residents and may include blood for some residents. Will your hands be exposed to blood and body fluids? Definitely. Wear non-sterile gloves. Perform hand hygiene before and after glove use. Will your eyes or face be splashed or sprayed with blood and body fluids? Wearing eye protection and a mask may be in your best interest. Personal protective equipment. Perform hand hygiene before and after glove use. And your hands will be exposed to saliva and possibly blood during your oral assessment and observing for the mouth changes. Make sure your gloves fit properly. Poorly fitting gloves can decrease your visibility for providing mouth care. It may increase your chance of being bitten, and if a piece of the glove is bitten off, it could be a choking risk for the resident. You will need to follow the guidelines and procedures of your facility. Make observations throughout the day. Each time you see the resident, talk with them, feed them, or even as they sleep. What are you looking for? As you approach the resident, look at the profile of their face. Look for symmetry, or the right and left side, to see that both sides of their cheeks, jaw, eyes, and ears appear the same, and that there are no signs of any swelling. Look for changes in the color of the skin, around their mouth and on their face. Look at the lips for signs of dry, cracked, or sore lips. As they speak or eat, look for loose wiggly teeth or loose dentures. You're looking at their teeth and their tissues. What do you see on the right photo? The next 5 slides are examples of healthy mouths. It is important to know what a healthy mouth looks like in order to make it easier to identify what appears unhealthy. Regular observations of the residents' mouths make it easier to notice any changes. Healthy soft tissue should appear light pink and uniform in color with no indication of swelling. Pink, smooth, and flat. No lumps, bumps, or sores. No changes in color. You want to look at the teeth, the gums, the tissues, and the tongue. Healthy teeth have no holes, are not broken, and are held firmly in the bone. Some teeth that appear longer may have slight movement as they are not covered by as much bone and/or gum. Some teeth vary in color and appear very dark or yellow with age. Teeth likely have fillings and crowns present. Metal fillings may appear black. Plastic fillings may be stained brown, especially around the edges. Crowns might be gold, stainless steel, or white colored. They may cover all the tooth or may cover part of the tooth. There may be bridges with a false tooth in the center, anchored to a tooth with a crown on either side. The roots may be visible and appear a different color, more yellow or brown than the crown of the tooth. Healthy gums are pink and firm around the necks of the teeth. Gums will not bleed when brushed. Also look at the saliva. You want the mouth to appear moist and shiny. Bubbles and shiny tissue indicate that there is moisture in the mouth, and moisture is important for the health of the teeth and the tissues. The left upper photo is showing a partial upper denture in place. The right upper photo is showing the removal of the partial upper denture by placing fingers above the clasp and pulling straight down. The middle photo, you can visualize the gum tissue that was below the partial upper denture and around the teeth that the clasps rest on. Gums should be pink and smooth around the natural teeth and around or underneath partial or complete dentures. Gums should not bleed when brushed. There should be no swelling. The tongue should appear moist, uniform in color, with no coating on the top surface of the tongue. The tongue should be symmetrical, both sides appearing the same, and the tongue should be free from any lumps, bumps, or sores. If the resident cannot move their own tongue, grasp it with a clean washcloth and gently move the tongue so that you can see all surfaces to the left and to the right. Always wear gloves to perform mouth care. Is there enough moisture in the mouth? Do they have enough saliva, or do they have a very dry mouth? This slide is showing the underside of the tongue. The left photo is showing that the tongue is pink, soft, and moist. The right lower photo shows the veins that are more visible. This is normal in an aging tongue.